Alright, second time trying to post this video. I'm Sarah, and today I'm going to talk about play therapy as an EBT. So some history about play therapy. Started off with Freud. He's the first to publish a documented case of therapeutic use with play with a 5-year-old boy who was at the time demonstrating some phobic symptoms. So he was the first, and then after that we have Hermione Hug Helmuth and also Melanie Klein, and then Anna Freud. And so they, all three of them, utilized play therapy to analyze children's emotional and behavioral lives. Melanie in particular initiated play therapy methods with children using play as a vehicle for free association. And then Anna Freud, she utilized play as a means to facilitate positive attachment to the therapist and also to gain access into the child's inner life. And then since then, obviously, we've learned a lot and have moved on and forward and pushed forward in these findings and in these practices. But in the tradition of play therapy, what it is founded in is basically connected to like the central idea that play transmits and communicates the child's unconscious experiences, desires, thoughts, and emotions. So the reason why I chose this the reason why I chose play therapy as an EBT for this particular project is because I'm in child and adolescent therapy right now. I'm in that class, and we've been learning a lot about the play therapy, so I thought it would be really interesting to share with you guys about it. And it's interesting because I didn't necessarily think of play therapy as an EBT. Not sure why, due to how effective it is and how useful. But yeah, so some research, lots of research to confirm that EBT is empirically supported. I'll share some different studies. Different types of research have been done too. So meta-analysis systematic reviews demonstrated statistically significant effectiveness for children participating in play therapy. In randomized control trials, it was demonstrated that children in play therapy showed statistically significant improvement in disruptive behaviors, internalizing problems, academic progress, relationships, self-concept, so many things. And then in observational studies of 4 quasi-experimental studies and 9 single-case experimental designs and 11 repeated measures single-group studies demonstrated that there were reductions in internalizing aggressiveness, attention deficit, trauma symptoms, so many difficult, challenging things that children have been dealing with. Improvement in self-concept, global functioning, relationship stress. Therapy has, child play therapy has been shown to improve all these different areas. Shown improvement in PTSD symptoms, disruptive behavior, improvement in autism symptoms, emotional disorders, improvement in developmental delays. So tons of different things. Over the past 2 decades, we've had well-designed controlled play intervention studies that have emerged. 2 meta-analytic studies have examined the effectiveness of play therapy with children, and collectively the 2 meta-analytic studies revealed that play interventions have a moderate to large positive effect. So there's evidence for so much positive effect and impact that play therapy has on children and families, and also, as I'll get into, not only children. So EBT, so the EBT use of play therapy, or I guess I should say play therapy as an EBT works best for children around ages 2 to 12. However, it's not limited to those ages. Play therapy has been helpful in working with teenagers and working with adults, and also in working with infants and toddlers. And so play therapy is starting to be used within like mental health agencies and other healthcare contexts. So that's exciting because it's increasing, and we know that it's effective. So play therapy can be helpful for any particular person, any particular child in particular, but specifically studies that have been done to show specific diagnoses that it's been helpful with GAD, generalized anxiety disorder, ODD, CD, ADHD, Tourette syndrome, OCD, PTSD, just to name a few. Also, just like children that have experienced, physical or emotional trauma, abuse, have been bullied, struggling with their relationships with authority figures, with their attachment, having any behavioral issues, any changes in their life, like parents are getting a divorce, parents are separating, some loss of a parent, so many things, any changes in their life, and just for any reason in general, play therapy can be helpful. For us therapists, some diversity factors that should be considered is that we need to remember that play looks different with all different types of children, especially when we have to consider families are all different. What children are exposed to in their families are different. The types of toys that they're exposed to are different. We need to, most therapists tend to believe that child's play is highly, similar across cultures. And yes, play in general is universal. However, the type of play is not necessarily universal. And we need to have the ability to differentiate between pathological and differences in cultural play. So, just being mindful of that, how children have different ways of communicating, and also thinking about the child from the family aspect, thinking about the child and their parent and child relationship, and just, thinking of the child not only from this American norm, and think of the child as a unique individual. So that's all I have for you guys. I hope that you guys learned something new about play therapy today. Bye.